It's Katie, nurse practitioner here at New Beauty Company Aesthetics. A question I get a lot from clients is, my Botox, it stopped working, years of treatment, and all of a sudden I'm resistant. Is this a real biological phenomenon? And what can we do if my body has built up a resistance to neurotoxin? I tell them antibody-mediated resistance to neurotoxins is a documented clinical thing, but it's way less common in cosmetic patients than in patients receiving therapeutic doses for things like cervical dystonia, hyperhidrosis in the armpits, and that distinction matters huge. So why? The immune system generates neutralizing antibodies against the botulinum toxin protein, specifically the heavy chain component responsible for binding to the neuronal receptor. These antibodies intercept the toxin molecule before it reaches the neuromuscular junction. So this basically renders the treatment ineffective before it even begins. This risk of antibody formation correlates with protein load, so the total amount of toxin protein delivered per session, and the frequency of injections. So high dose therapeutic patients, like 200, 400 units per session, can develop a resistance much more often than a cosmetic patient that's getting 20 to 60 units every 3 to 4 months. This true resistance is far less common in cosmetic patients. The more frequent culprits are for those that stopped working are most likely a provider switch, different dilution at different practices, anatomical changes that alter how the muscle responds, and not enough muscle for maybe if there was not enough units for maybe some muscle bulking. If your body has a true resistance, there is a solution: switching from neurotoxin to neurotoxin. So we do have different types that have type A, type B, that don't always cross-react. So we like to assess treatment response systematically, and we like to document your results at every visit. So you'll notice at our visits that we're looking at how much did we dose you with, what movement are you having afterwards, and are you getting that 90 days of results. Patterns of declining efficacy trigger a clinical conversation rather than just recommending more units or the same dose.